Welcome to Frontiers of Brain Health, where we take a deep dive into the most exciting new developments in brain research. I'm Francesca Filbey. I am a professor in the Department of Psychology at the University of Texas at Dallas, and here at BrainHealth, I lead the neuroimaging of reward dynamics, where we look at addiction as a model of reward dysfunction. In terms of the presentation that you'll be seeing here today, please make sure to hold your questions until the end. So for the virtual audience, please use the Q&A function. And for those in person, we will make sure that someone reaches out to you for your questions when they're ready to be asked. We'll get as many of you as we can. And as a reminder, this presentation is being recorded. So for those who don't know much about us, the Center for Brain Health is a cognitive neuroscience research center at the University of Texas at Dallas. We've dedicated the past 3 decades to exploring neuroplasticity and the brain's amazing lifelong potential to get stronger and work better. Without further ado, I'd like to switch over now and introduce you to our speaker. I've been very excited to have him speak to us, and we're actually doing a tag team presentation today. Dr. Harold Urschel is a renowned expert in addiction psychiatry and neuroscience. He's a co-founder and a senior consultant of Enter Health Treatment Centers here in Dallas-Fort Worth, one of the finest residential and outpatient treatment programs in the nation. Dr. Harold Urschel works with Enter Health's team of medical experts in the field of addiction and psychiatry, including physicians, nurses, psychiatrists, and licensed therapists to implement the most advanced science-based treatment protocols grounded in the latest NIH research, incorporating them into individualized treatment plans that address all aspects of each patient's addiction and mental health issues. Dr. Urschel has spent more than 35 years in the fields of addiction psychiatry, neuroscience, and clinical research, known as one of the most foremost authorities on substance abuse and addiction in the country. Dr. Urschel is the author of the New York Times bestseller, Healing the Addictive Brain. He is a coveted speaker of substance use and the latest opportunities to treat the chronic brain disease of addiction on both the local and national stage. So please help me welcome our speaker, Dr. Harold Urschel.
Is that on now? Yeah. Perfect, good. Thank you, Francesca. So it is going to be fun. I just wanted to say what an honor it is to be able to be here at the Center for Brain Health, and all the amazing work that Sandy and her whole team does here makes a huge difference in trying for us to be able to help our patients. So just know when you're getting frustrated in your research, et cetera, keep plugging away, because research is hard. I've done it. I've not done a lot of the clinical stuff that you've done. I've done more pharmaceutical clinical research, but it's still, everybody has a role here, and so keep it up, because we need that information helping our patients. And we are going to tag team here together. Let's see. So this is my favorite topic, and I think obviously Dr. Filbey has dedicated her whole career so far to this topic in general. And marijuana, cannabis, weed, pot, all the same thing. And there's so much misinformation out there about it that we need to try and give people accurate information on which they can make good decisions. That's what this is about, is trying to give people, there's so much misinformation, and so in any situation, knowledge is key, and we're not trying to tell people to use marijuana or not use marijuana, but if you look at the data, I don't know why you'd ever want to use marijuana if you really look and see what it does to you. Not believe, everything we're giving you is openly plagiarized from the NIH, and it is, this is a good thing. We're just giving you information on hard, good research that's been out there. And just think about this. I work with a great team to run an addiction treatment center. I'm out there encouraging people not to use marijuana. Well, I mean, I'm basically turning business away from me because you're going to see how addicting it is, right? You know, and so, like, I have no vested interest in doing this other than this is the right thing to do. If I'd rather people not come to my treatment center because they never got in trouble or never even had to use it. And most people that use marijuana don't get addicted. Most people that use marijuana, like most people that use alcohol, don't get addicted. But anytime you're using marijuana, it's not helping your brain at any level. And and you will find other work, etc. So we're not going to talk a lot about addiction until the end, because this is really about cannabis. But I'm going to go over here and just, the pointer doesn't work, so I'm going to use my arms, etc. How do you get addicted in the first place? Well, if you look at it, this is a spectrum of use, all right? Most people are using a little bit of alcohol, or some people are using drugs in these days with cannabis, etc., and maybe nicotine, right? It's out there too. Caffeine. Don't really qualify caffeine as a drug in terms of detrimental, not that it's outstanding for you, but maybe 35% of the country don't use anything. Most people just use it every once in a while. A subset of this go on and they start using it more frequently, all right? And they're using it maybe a couple times. This may be a couple times a month, all right, or once a week on the weekend. This may be a couple times a week. Still, especially if you're looking at this model, this could be for alcohol, this could be for marijuana. Now, if you're shooting IV heroin and you're even doing it a couple times, I really have concerns for what's going on. But for most alcohol, a lot of people will use alcohol a couple times a week, no problem. And then chronic means daily use in this terminology, and people using alcohol daily. A lot of them aren't addicted. Have a couple drinks, no problem. All along this spectrum, not when you don't use it, but all along this spectrum, whenever you use any substance, it's hurting your brain. We'll talk about that more specifically in a few minutes. But each time you use the substance, depending on how much you use, depends on your genetic makeup, depends on what other medical illnesses you have, etc. How it affects your brain is a very individually specific situation, but at some point you've done enough injury to your brain that you now actually create an illness. So this sort of a magic line between chronic and compulsive, you can see over here, where it's the chain, you're now tied to the substance. And for alcohol, it means you can't stop, or any other drugs, you can't stop it on your own without treatment. Now you can, like if you're addicted to something, let's say alcohol, and you try and stop on your own, you have a 6% chance of getting sober by yourself, okay? 6. Whereas if you get treatment, now when you apply it as what we're going to show you later on in the talk, you have about a 90-95% chance of long-term sobriety, getting your life back, changing the trajectory of your life and your kids' lives and your family for generations to come. So the bottom line is your brain's been injured. The more you use, the more injury you get. Most people are okay with that. They don't even know what's going on. And then something at some point, whether it's marijuana or cocaine or heroin or dilaudid or marijuana, it's going to do enough injury. You're now addicted, and now you need treatment. We don't want people to get there, and we don't want people to be hurting their brains even before they get addicted. Because the more you hurt your brain, the less quality of your life you have, right? So let's talk about marijuana now. There's enough about addiction. So when marijuana is legalized in a state, so I think it's about 36 states have legalized marijuana now. Marijuana use in all forms goes up. So as soon as the state legalizes it, the amount of use in that state goes up significantly, all right? Especially among the young. So we're going to talk about that. All brains are hurt by marijuana. A developing brain is hurt exponentially worse by marijuana, and it's true really for all substances. And when you legalize the substance, does that mean it's safe? Are we saying, hey, it's safe? No, it just means that you can sell it legally without going to jail, right? And as soon as it's legalized, marijuana distribution companies come in and they open as many shops as possible. The more shops they can open, the more money they make. But the more shops they open, the more normal it looks. So let's give you an example. One of the first 2 states in the country that were legalized marijuana, people know what they are? Colorado, Washington State. Okay, those were the first 2. Now there's a lot more since then. So we looked at Colorado, they did a study, and if you took all the McDonald's and you took all the Starbucks in Colorado, say Colorado, put them together, you have about 300 stores. Okay, all marijuana and all Starbucks. Excuse me, all McDonald's and all Starbucks. All the marijuana stores, over 1,000, all right? So you're looking at 3 times the amount of stores. So if you're thinking, hey, I see Starbucks, I see McDonald's, I think I'm seeing McDonald's everywhere, right? But if you're seeing, 3 times more marijuana stores, oh, that can't be bad for me. And this is subliminal messaging. This can't be bad for me because they're everywhere. How can this be bad? So anyway, it just normalizes use. Another way, and again, the people selling marijuana to us have a lot of money. Their vested interest is to make a lot of money, and they can make a significant amount of money, so they spend a lot of money marketing it, and they have great, really brilliant people behind their marketing campaigns, and so the goal is, hey, I want to take a neurotoxin that you're going to put in your body, and I want to convince you that it's safe. That's the idea. That's what THC is, all right? I'm not saying THC can't be used appropriately in certain situations by filming. I'm not saying it's terrible. I'm just saying when you're smoking it, when you're eating it, and when you're using it in a commercial preparation, it is very detrimental to your brain. And so I took a picture. I was invited to do a lecture up in Washington, went outside the Seattle Tacoma airport. It was probably about 10 years ago. And it's like a rental car bus. This yellow bus pulls up, and it's called a cannabis. Right? And it's a shuttle, leaves every 20 minutes. It takes you to go buy free pot and brings you right back to the airport. All right? So again, I'm not saying that's good or bad. I'm saying think of the subliminal messaging. I mean, when I see a Hertz van come around or an Avis van, I'm not thinking, oh, that's kind of normal. That's just a normal part of our society. It's just saying, hey, this messaging is everywhere, and you have to be aware of it. The point of this lecture is to give you accurate information. And it's kind of like we're fighting this, with like a little syringe of water. I'm shooting out water, and at the end, out of a fire hose is coming back the other way. That's the problem. THC. So in cannabis, in marijuana, there's about 250, 300 substances when you're smoking it, all right? And the 2 that are more psychoactively active that we know about, that we focus on these days, is THC and CBD. So this graph is how the percentage of THC that's out there in your average marijuana. This is 1995. This is 2022. And Dr. Filbey, I have to give her credit. She helped me update the slide. I've used an old slide that was 1960 to 2011. All right? In 1960, it was 1%. So if you take all this down way out here, so the pot in the 60s and 70s was 1-2% pure. Now we're looking at 2022, it's 16% pure. This is on average. All right, and so this is in illegal marijuana and legal marijuana. We average everything out, and the higher the THC, the more neurotoxic it is. The higher the THC, the better high you get, the more dopamine it releases. And the higher the THC, the more addictive it is. So if you're trying to sell this product, what you want to do is you want to get it, the higher the THC level you can put in the plant or put in whatever you're selling, the product you're selling, the better they're going to feel, and the more higher chance of getting addicted. And if I get you addicted, that's a consistent money stream. All right? Again, I'm not trying to badmouth. This is a business transaction. But the higher THC, just remember, is toxic. Higher THC, much more dangerous to your brain and your other bodily organs. The blue line is CBD. CBD at this level, at this time in our scientific understanding, I have not seen any data that it's really addicting or that it's bad for you. There's some good medical uses of it, et cetera. It's just there in the plant and we're using it. Okay, we're using it for other reasons. And we can get into that later maybe in the questions. So let's talk about that potency for THC. Potency means the percentage of THC. So in 60s, 70s, the Woodstock weed, 1 to 3%. Average potencies you saw about 17 to 19%. That's just that's what you're smoking. They have concentrates. They have ways to make it more potent. You can go into a marijuana store. You can buy it online. 55%. So 55% is huge. All right. The problem is you can have these other things called dabs, and then vape. The vaping epidemic with THC is catastrophic right now, especially when in our adolescents, you're getting upwards of 99% pure. All right, incredible high, makes you feel really good, and there's a whole lot of other problems, but it's very, very toxic. All right, and you can buy pure THC in retail stores, from marijuana retail stores. The high, we already talked about that. One last thing about this. Even though the THC potency is going up, people think, in general, people are thinking marijuana is safer. Like, all these things are changing, and so you have, it's getting more and more dangerous, and people are thinking it's more and more safe. That's this disconnect. That's why we're taking our time to talk today. All right? Vaping, I mentioned that. So vaping, I hope you all know what it is. It's basically you're taking a liquid, you're running it through a little vape machine that heats it up, and you're taking the vapor into your lungs and you're absorbing it. It kind of started out with nicotine, and then so the cigarette companies, they were making a lot of money cigarettes. Then the cigarettes had the whole cancer scare. The cigarette companies lost a big billions of dollars lawsuit. They lost their lawsuit because they got caught with hard data showing they were knowingly increasing the percentage of nicotine in the cigarettes to make them more addicting, so they'd be able to make more money. That's why they lost the lawsuit. So they now can't increase the amount of nicotine in a cigarette because it's highly federally regulated, and so they went ahead and they bought the vape companies, and then they bought the marijuana companies. So most of the larger marijuana distribution companies are owned by the tobacco, Philip Morris, those people, big global conglomerates, and they're using the same playbook that they use to bring cigarettes out in our society, in marijuana, and that's why it's working so well. And they have so much money behind them, right? So vaping delivers 70 to 90% THC. Vaping is popular because it's very easy to hide. I mean, this remote is bigger than most vapes now, right? You have a Juul, you could actually hide it in your hand and vape in class, and you don't see any vapor coming out. You don't know, but you're getting a really intense amount of THC. It feels really good, and nobody knows until bad things happen. At this point 3 years ago, over a quarter of all 12th graders were vaping in the last year, and it's become normalized. The vaping companies targeted adolescents, and the adolescents started using it for nicotine, and now the THC company, they're putting the pods are being filled with THC oil, and so this group that's already used to vaping as a modality, they're using a lot more THC, and so about 25% of most adolescents are using vaping quite regularly. And when they use marijuana, their preference is now to vape it. They're not smoking it, they're not eating it, because they can hide it easier, and they get a better high. All right? All right, one of the things about THC that's important, we're not going to go into the chemistry or biochemistry, etc., but it's the problem with THC. People always ask me, Dr. Urschel, is alcohol worse for you or marijuana? Right? Yeah, I'm sure you all wondered that. I'm going to come over here. I'm sure you've wondered. Most people using marijuana are also using alcohol. Most people don't use, now a lot of people who use alcohol don't use marijuana. But if you're using marijuana, you're probably using alcohol, maybe not at the same time, but usually within a time context that's similar. If you drink a lot of alcohol how long will the alcohol stay in your system? Worst case. I mean, best case, how long does the alcohol stay in your system? You have one drink, it goes away in an hour, right? And so that's why you're thinking about drinking and driving, all that, you do the math. So you can drink a lot of alcohol. After 24 hours, it's pretty much out of your body, unless you just drink so much, but by that time you might have killed, be dead. But say 24 hours. If you smoke one joint, okay, one joint, use it only once, that THC gets into your bloodstream and it loves fat. It's called lipophilic. So it goes in and hits, the THC molecules attach to all the fat cells in your body, or a lot of them. And then over time, they leach out into your bloodstream and then get processed by your liver and kidney, et cetera. So one joint, you'll have THC in your body for up to a week. All right, that's the problem. There used to be this myth, and it probably still is, that you could smoke marijuana, at a football game behind the stands and on a Friday night, and you could still be fine for your test taking on Monday or Tuesday. Well, we know that that's total bunk, because that THC, especially if they're vaping it, the higher the THC content, the longer it lasts. So one use of THC, it's gonna be there for a long time. And so if you have 2 drinks of alcohol and it's out of your system, let's just say not 2 hours, let's just say 6 hours, all right? And then the next day, if you have 2 drinks of alcohol, you just have 2 drinks of alcohol. If you have 1 joint, and then the next day you smoke another joint, well, there's still some THC left over from the first joint, and you're adding it. And then let's say you wait 2 days later, all right? And you're having a 3rd joint on day 4. Well, you're still gonna have some of the THC from the day 1 and 2 adding up. So it adds up exponentially. That's the problem with THC. And even though you're not high during this time, the THCs in your body hitting your brain and all these other organs, we'll talk about that in a minute. So if you use it once, it lasts for up to a week. Usually once it lasts for 2 to 3 days, in terms of this is how long you can detect it in your urine, all right? If you do 2 to 4 times a month, so once a week to once every other week, it can stay in your body for 3 weeks. So if you use once a week and you're using it once a week, et cetera, and then you stop, it's going to take up to 3 weeks, 2 to 3 weeks to clear. If you're using 2 to 4 times a week, not a day, all right, and you stop, it'll take you up to a month to get it all out of your system. So for that month after you stop, it's still going to be bothering your memory and your attention and all that. 5 to 6 times a week, all right, a month and a half, all right, you're using it daily, it can take up to 3 months to get out of your system, and we see that all the time at Inner Health, which is a problem. All right, so let's look, we talked about the brain, we're talking about the brain more, Dr. Filbey's an expert on that, but let's look at the organs, all right? The smoke from a marijuana, now people say, well, I'm not smoking the joint as much. There's still a lot of people smoking joints, they're also doing edibles and they're doing other, vapes, et cetera, but they're smoking a lot, all right? And the smoke from the marijuana itself, when it goes in the lungs, is 4 times more carcinogenic, all right, than cigarette, and we know how bad cigarettes are. Our research has found a connection between marijuana and lung damage. On top of that, if you're vaping THC, you're getting the injuries from the THC in the lungs and from the vape. Vapes are very toxic to your lungs. And then basically, depending on how you use the marijuana, the American Lung Association has showed these are the differential ways that you're hurting your lungs, right? So bottom line is, it's not safe there in your lungs. In your heart, if you smoke marijuana, there's 4 or 5 cardiovascular journals a year are publishing more and more data on this. It creates significant risk, smoking marijuana, significant risk of cardiovascular problems, heart attack, arrhythmias, which is a regular heartbeat, high blood pressure, and injury to the heart muscle, all right? Do you all know which substance of all the substances is the worst for your heart muscle? Anybody know? Alcohol. Alcohol is probably the #1 cause of cardiomyopathy out in our country right now, right? Not just alcoholics, just people using alcohol. Very toxic. Marijuana is toxic to your heart muscle, and marijuana can double the risk of stroke, even in young adults, okay? you don't think about this, right? This is like this safe, legal substance. There's no harm using it. That's not true. Sexual dysfunction. It impacts your sexual health in many ways, changes your sex, so it gives feedback loop in the hypothalamus and other areas of your brain, changes your sex drive, makes you higher chance of risky behavior, just like alcohol does, changes your testosterone and your estrogen, progesterone levels, changes your fertility and major implications in sperm motility and sperm effectiveness, decreases your sperm count, actually can decrease decrease testicular size because of the feedback on the loop. Now, when you talk to a teenage boy, I do a lot, or I used to do a lot of talks in high schools, when you talk about to a teenage boy, anything you talk about in terms of, shrinking things down here, they start paying attention, right? Now, there's no data yet saying, shrink your penis. If we could just do that, we wouldn't even have to be worried about that. There's nothing out there right there saying it. But it is linked to testicular cancer. Again, you're thinking it's safe. This is hard research showing that it's not. Chronic pain. We have a study right here on your table that Dr. Filbey is doing. People taking marijuana for chronic pain all the time. Chronic pain. Mounting evidence suggests that marijuana use, especially chronic use leads to poor pain control, right? And that marijuana is no better than a placebo for pain relief. Right? Hospitalizations, high chance that 25% of marijuana usually go into the hospital ER, especially for nausea. There's this extreme hypervomiting episode, syndrome that people are going to because, again, it's getting so potent out there. Pregnancy. I'm going to speed this up just a little bit. Pregnancy is a real issue because remember I told you it's very injurious to a developing brain. Well, the fetal brain is growing exponentially more than your adolescence, right? And so one of the things marijuana does is it lowers your nausea, right? So you go into a pharmacy, if you're pregnant, you go to a pharmacy and you mention that you're having morning sickness, they'll say, oh, take some marijuana, it'll really help decrease your nausea, which it will, right? And so women are being, 7 out of 10 dispensaries recommend marijuana to pregnant women. It's incredibly toxic on so many levels. You can just look at this for the fetus, right? And it inhibits their fetal and brain and neural development. Fetuses that have been exposed to marijuana in utero have all these issues of problem attention, social behavior problems, and the Surgeon General said, he put out a specific report saying do not use marijuana if you're pregnant in any way, shape, form, or fashion. This is also to do with secondhand smoke, right? So pregnant women should not be around secondhand smoke of marijuana, etc. Right? Mental health, psychosis is the really big, scary thing that's out there for your mental health. Is the higher the potency, the higher the chance of psychosis. At Enter Health, we have a residential treatment program. It has about 38 beds. Here in Dallas-Fort Worth, we have an outpatient clinic, but a lot of people in the treatment community, they'll come to our outpatient clinic. About 40% of all the people that need a treatment have to go inpatient. It's severe enough they need to go into like the hospital, right? They're there. And so you have to be pretty severe to get in the hospital in the first place, right, in terms of your addiction. So 25% of all of our admissions are marijuana. Primary marijuana is the problem. People think it's not addicting. That's total bunk. 25% of our admissions are primary marijuana is the problem. They may use other things, but marijuana is their identified real source of problem, and half of those are psychotic. So they're coming in psychotic. Luckily, most of those patients that come in psychotic, we can use antipsychotics and we stop, and over time their psychosis clears, but probably 10% of those people that get psychotic have schizophrenia. Would they have had it without, would they have had it without, and some of them have bipolar disorder, long-term bipolar schizophrenia, because of high, heavy use of regular chronic marijuana use, something that's very safe. It's supposed to be very safe and innocuous, and everybody's telling them that, and everybody else in school is using it, right? And finally, you get to stop listening to me. Let's talk to an expert here.
First of all, thank you. This is very encouraging that actually and we'll hear more from Dr. Urschel in a bit too, but it's really encouraging to see science-based or evidence-based treatment approaches, so thanks for that. My goal here today is to show you some of that evidence. We're going to focus on how it affects mental health. I'm showing you here some work that we did in depression. And really the take-home message is that cannabis use complicates the picture. So treatment of mental health disorders is already pretty complex, highly heterogeneous in terms of presentation. So when you add things like substance use, things get even more complicated. And that includes cannabis use as well. What I'm showing you here is what we found in terms of changes in the brain related to individuals who use cannabis to alleviate symptoms of depression. What you're seeing here in the image are changes within the anterior cingulate cortex of the brain, which is important for executive control. So these are areas of the brain that really allow us to inhibit responses and really control our behaviors. And what we find here is that the greater the depression, the greater the connectivity within those two areas of the brain, which might indicate some type of dysregulation within that, those regions. Recent work that we're also doing here in the lab, led by my postdoc, Dr. Chuck Liu, who's in the audience, is looking at other networks like the subcortical resting state network. So this is when individuals are not doing anything. So this, you can kind of think about this function within these regions as your baseline state when you're not task focused. And this subcortical resting state network is especially important for reward and memory. And what we're finding here is a great example of how complicated the picture is. I'll draw your attention to kind of the extreme examples within this graph here. On the bottom line is depression scores. So the greater, the further to the right, the greater the depression. And then the y-axis here is the connection within those subcortical networks, again, important for motion, reward, and memory. And then what you're seeing in the different dotted lines are times of cannabis use per week. So I'll draw your attention to, again, the most extremes. The broken line here on the very top are individuals who do not use cannabis. And then on the bottom line are individuals who have the greatest cannabis use, about 70 individual occasions of cannabis use per week. And so what you're seeing here is a really striking inverted relationship depending on how much cannabis use you have. What I'm going to point out here is where you see that inflection point, which is a really minimal level of depression. So even with just sub-threshold depression, not clinically diagnosed, you can see the effects on regions of the brain important for memory, emotion, and so they're not able to signal to each other in an effective way to guide behavior. Oh, thank you. And let's not forget cognitive function. So aside from diagnosable mood disturbances like depression and anxiety, there are also impacts in just cognition. Here is an example of what we found in terms of memory. This memory impairment is probably the most widely reported impairment related to cannabis use. And what you're seeing here is how regions of the brain that underlie memory functions, like the hippocampus and amygdala, do see changes with cannabis use. What you're seeing in the black bars here are individuals who use cannabis compared to those who don't, which are shown here in the white bar. So you're seeing changes in the actual gray matter volume of those critical areas for memory.
Okay, great. She's going to come right back, don't worry. So again, clinically what you're seeing in adolescents who are using marijuana, frequent use is usually 1 time per week or more. So remember there's different frequencies, but 1 time a week per more. Changes in the brain involve memory, attention, decision making, and motivation, just exactly what she was saying. Memory and attention deficits have been detected in teens even after 1 month of sobriety. Remember how long it still took to get out? You know, just the THC. Well, these effects are going on. And so think about if you're a teenager, you're junior year in high school, you're your sophomore year in high school, you're doing the tests, you're coming up to finals, you decide you're smoking too much weed. You're impairing your cognitive capabilities for a long time without knowing it. Chronic use has shown, without question, some really long-term studies decline in IQ, which then leads to decline in school performance. It can show, so long-term use decreases school performance, jeopardizing the professional and social achievements, and increases rates of school abstinence and dropouts. The whole problem is, my point is, you have these teenagers that don't know it, they don't know what's going on. They think they know everything, right? Okay. But they don't, they're going based on what data is showing them, what their peers are telling them, and they're putting a substance in their brains, and even the families are aware. They may be aware, they're not worried about it, we're not going to fight it, but they're changing the trajectory of their lives without having the data that they're doing that in the first place. And they can't tell it while they're doing it because, as she said, marijuana, just like other substances, it takes out the frontal lobes first. So it takes out your cognitive, your insight, your decision-making abilities first. So it's the capability of your brain to help you make good decisions, long-term, delayed gratification decisions. It takes that offline, and all you have left are short-term, immediate reward decision-making. Back to you.
Yes. So. Continuing the message that adolescent use is a critical, adolescence in general is a critical time period, and so introducing cannabis during a time when your brain is undergoing these critical and long-term changes could really lead to deleterious effects. Work that we've done here and what I'm showing you here has found that people who use cannabis early in life, especially during adolescence, really have long-lasting changes that are different from individuals who wait until they're adults. So not only are cannabis the function of the brain in adults who use cannabis different, but it's even more pronounced in those who start early in life. And so what I'm showing you here is when the brain is in the presence of cannabis cues. And we call this conditioned cue response, which is what triggers craving in individuals who are addicted. So it really makes abstinence difficult. And so you can maybe think about it in terms of how you're craving the chips that are in your box right now. That kind of desire to eat the chips even when you told yourself you weren't going to. And so it's really very difficult, and it's a primary symptom for the diagnosis of addiction. And in individuals who use much earlier in life, so again during this critical time period, it appears that these brain mechanisms that result in this intense desire to use is even greater. So you can imagine it's probably manifesting in much more greater challenges for them to abstain. In terms of how other factors early in life, like stress, might interact with cannabis use. It shows similar complicated picture as I showed you before. Again, this is work by Dr. Liu in the lab. And this is important because early life stress, and we're not talking about getting bad grades, we're talking about early life trauma. It could already lead to long-lasting impacts in the brain. You can see that here in terms of individuals who have had 15 different self-reported traumatic events in early childhood, before the age of 18, and that's shown here in the solid line, where you can see that that there are changes in the brain. And also here in the broken lines are individuals without early life stress. And you can see that there are without taking cannabis use into consideration, there are already differences within those individuals. But then there's that inverse effect, again, when cannabis use is presented, which is important to remember because, again, a lot of times cannabis is sought after in order to deal with these kinds of traumatic events.
All right. So marijuana, people don't think it's addicting, and if they do think it's addicting, they don't think there's a withdrawal. Okay, now not all substances have life-threatening withdrawals. Marijuana withdrawal in general is not life-threatening. The problem with marijuana is, remember how long it lasts in your body, the THC? So you can stop it, and if you're probably not going to get marijuana withdrawal unless you're using a couple, 2 or 3 times a week, all right? If you're just using it every once in a while, you're not going to get withdrawal, but when you start using it daily and you stop, so you're using it daily, you get addicted, and you stop, you're not going to have any withdrawal symptoms for probably 2 to 4 weeks. So you stop it and you feel fine. And then 2 to 4 weeks later, when you think you're out of the woods, that's when you start having these symptoms, irritability, cravings, anxiety, sleep difficulties. And since you didn't have withdrawal in the first place, you'd convince yourself you're not addicted, right? So if you stop alcohol and you have really bad withdrawal for the first couple of days, you stop heroin or Percocet or hydrocodone, and you get withdrawal within 2 or 3 days, go, oh man, I had a problem. That substance was really bad for me. So you have these 2 different points in time, and you come up with a decision in your brain. Here you're not even aware of it, and so you don't think you're addicted, and then when you get it, when you get the symptoms, what's going to help you make that feel better? Marijuana. You take another joint. I can have it because I'm not addicted. That doctor didn't know what he was talking about because I didn't have any withdrawal symptoms. So bottom line is, you have it, it's just significantly delayed. And they're very uncomfortable and they can lead to relapse.
Thank you. So I'm going to show you work that shows what the mechanisms of cannabis use disorder might be. And important to know, following up on what Dr. Urschel said, is that withdrawal effects are real. In fact, when we bring participants to the studies that we have here, these are, again, adults who regularly use cannabis, we ask them to abstain for 3 days. The reason why we ask them to abstain for 3 days is because we want to see the withdrawal effects at their peak level. And so what we're ultimately faced with are individuals who are very grumpy, who are very irritable, do not want to come at all, because they realize that they are actually experiencing these negative effects from their cannabis use that they never had to face before. So what I'm showing you here, again, individuals who are abstinent. So we're not looking at acute effects here, so they're not intoxicated, in other words. And we're comparing people who have a diagnosis of dependence compared to those who do not have a diagnosis of dependence. This is work by Joseph Dunlop, and he was here in the lab. And what you're seeing here in red, so it's an MRI scan where individuals, again, are exposed to cannabis cues to trigger that intense craving to use. What you're seeing here are areas of the brain that are much more active when they are
Testing.
When they are exposed to cannabis, where it's greater in those with a diagnosis of cannabis dependence compared to those who don't. And so really what this is showing is that we are able to show neurobiological evidence that cannabis use disorder is observable in the brain. I'm not going to go into too much detail here, but it is also showing in this slide how these different networks between non-dependent users and dependent users are different, meaning that the way that these brain regions that usually interact to regulate our behavior no longer have those connections or the signaling between them. So as you can see, these are individuals who are not dependent on cannabis because, remember, Dr. Urschel mentioned that not everybody gets addicted to a substance, even if they use. And as you can see, there's a distinction between these regions of the brain and these regions of the brain that isn't within those individuals who are dependent. So it's possible that in the presence of those cannabis cues, these regions such as memory and emotion really guide the behavior of individuals and drive their drug seeking.
So we're not really here to talk about addiction treatment, but bottom line is there are medicines to help you through the withdrawal. There's no FDA-approved medicines to treat marijuana addiction or marijuana withdrawal, but we can use FDA-approved medicines that can help alleviate a lot of the symptoms. So these are medicines that are very safe. We use all the time. So Seroquel is an antipsychotic. You can use it at a very low dose, help you sleep. It helps you, lowers your anxiety. Trazodone, antidepressant, helps you sleep. Vistariel, which is like a turbo Benadryl, can help lower your anxiety, etc. And then different types of antidepressants can help as well over a longer period of time, help with the depression, the anxiety, the irritability, etc. One other thing I'm going to talk about just very briefly, and that is, so THC that we understand is delta-9. So these are the different isomeric forms of it. So delta-9 is from the marijuana plant. All right. There's also out there being sold on the street, sometimes now in gas stations legally in Texas because of a loophole in a farm bill in 2018. They have these delta-8 and delta-10 marijuana, and people are thinking, oh, this is safe, this is from the plant. Delta-8 and delta-10 are actually they're created purely from chemicals. They're nothing to do with the plant. And most of those chemicals are coming from Southeast Asia, jungle labs, and nobody really knows what the formulations, the chemical structure are between the different pouches of things or the different brands of whatever you're buying. You have no idea what it is. And so, but people think, oh, it's marijuana, so it's safe. It's marketed as a byproduct of marijuana. It has nothing to do with the plant. And it can contain up to 99% THC. Okay, remember that potency is super dangerous. Creates a lot more psychosis because, again, you don't really know what you're putting in your head when you're getting something made from just a chemical lab. FDA is super concerned about this, put out a lot of warnings about it. So nothing safe at all about delta-9 and delta-8 and delta-10. People need to run away from as fast as possible. All right. Let me just talk a little bit about addiction, then I think we're going to stop here. We're going to have a few closing slides, and then we'll stop. Basically, if alcohol and drug addiction, not just marijuana, it's not a weakness, it's not a moral failure. It's essentially mild to moderate, temporary traumatic brain injury. So alcohol and drugs are neurotoxins. They injure the brain at a mild to moderate level, and the brain will heal, thanks for all the research you all were showing us. It just takes about a year and a half. But because they're neurotoxins, there's no safe level of use. Okay, there just isn't. But if you understand addiction as what the science says, it's a mild to moderate, temporary traumatic brain injury, and you approach it with the tool set that you need to get better, all the different tool sets that you need, and I'm not going to go through all these, but a lot of these are brain, this is the next generation of TMS, brain, psychiatric, you have some withdrawal, giving coping skills, working with the family, work on your medical issues, functional psychiatry, getting to the root cause in terms of your gut, etc., medications in certain cases, individual group therapy, AA by itself is not sufficient to treat a mild to moderate temporary traumatic brain injury. It was never created to do so. All right, and so, but most treatment out there still today is primarily AA. So people that have alcohol or drug addiction are not getting all the tools, and even the programs they're going to don't know that they need to add the tools or they can't afford the tools. And so that's a real problem. But if you apply the tools, you have a 90-95% chance of long-term sobriety and beating this thing, which is huge.
So it's really encouraging to see, again, evidence-based being applied to ensure that treatment is effective. I wanted to talk a little bit about the kind of work that we're doing towards that goal. We're looking at different pharmacotherapies, neurosteroids like pregnenolone. This is actually an over-the-counter drug that's being used or being marketed for improvement of memory, but we're finding actually that it's also able to regulate the response to cannabis because it targets the same receptors of the brain, the cannabinoid receptors. We're also looking at ways to stimulate brain function through different devices like transauricular vagus nerve stimulation as well as transcranial magnetic stimulation. These are medical devices that have already been approved for other conditions, so we're testing its efficacy in terms of supporting abstinence in individuals or reduction of use in individuals who use substances. And then we're also trying to improve existing interventions like psychosocial interventions, specifically motivational interviewing. One of the things that we're doing here is really exciting is the use of the MRI center using hyperscanning, where we are actually looking at peer influence, a big motivating factor for adolescents specifically. We're trying to see how the brain might respond to peer influence and guide their behavior change.
Two closing slides. So there's a great deal of misinformation. All brains are significantly injured by marijuana. Not the end of the world, but it is. It's not a safe substance. Drug addiction is a medical disease. Marijuana is addictive. It's not safe. Vaping is worse. Marijuana is totally dangerous for pregnant women. Marijuana and THC may be legal, but it's not safe by any means. That's an incredibly important message. It's legal, but it's not safe. There's a lot of scientific data, reams of it, showing the dangers. Marijuana companies, they misrepresent the benefits. They want to sell a product. We didn't really get into medical marijuana. I'll just skip that for right now. And most people don't know this. All right? Treatment of marijuana and addiction, you have a really high chance of getting sober and being successful. People are so hopeless about, why am I going to go to, nothing really works, nothing's going to get better. Most of the time people don't get better in addiction treatment because they're not getting the right tools. All right? And so we both have books out there, very good, highly recommend if you're interested in the area. And we're running just a few minutes. We still have plenty of time for questions, but I'm sorry we don't have a little bit more time for questions. Happy to get started. I'll let you run them.
Sounds good. Thank you for your attention. We do have time for a couple of questions, and then we'll also turn to the audience online. Steve?
I'll just take here. Thank you. So you were encouraged. I'm kind of angry and confused. I agree we've made it legal, but how do we not hold these people accountable for truth in advertising? This is worse than I thought it was, especially with adolescents. And is there a way to predict someone being more likely to have an addictive personality so that there could be interventions on the front end? Because again, we seem to be tackling this after the fact rather than doing more than just saying it's bad for you. And we shouldn't apologize and say, don't do it. I don't know why you wouldn't just come out and say, don't do it. There's nothing good about it.
Right. Well, I tell people all the time, don't do it. But then, they don't listen. It's a great question. I don't know about the whole truth in advertising. I just feel sort of fatalistic. That's not going to change right now until people get really upset about what's going on. And my goal is to get this information to the families, to the parents, so that they can intervene in their adolescents' life. And there's a lot of very, very bright young people in our country. They need to understand these. Again, our goal, we want to give you the data to make good decisions for the impact of your life. It's a great question. I don't know, or I don't have the bandwidth. My goal is just to get the information out there. And there's probably a lot of really smart, capable, powerful people in the room, or that maybe are online, that can help us make a difference. A lot of people are trying to, more and more people are trying to do it as they find more and more dangers, and more kids die, and more people get, permanent schizophrenia or bipolar disorder when they're 15, right?
Is InterHealth doing anything like to give talks in junior high schools and high schools?
Absolutely.
We have to start. I practiced in the inner city for 28 years.
Right.
And this marijuana thing is so destructive to the young minds in the inner city because it's culturally accepted. So I think that we have to get at least 6th grade, 5th. There are some children smoking weed in the 6th, 7th, and 8th grade.
That's where you're targeting the vapes too. You're targeting the same groups.
Help doing anything as far as like community outreach and intervention with these elections.
Absolutely. I guess one thing I didn't put up there is just in case, these are just some websites for EnterHealth. EnterHealth.com, you can go, you can reach out. We're happy to do so. Dr. Filbey also have some great resources here as well. But again, another great thing, sir, is that these are recorded webinars. I have probably 5 really good recorded webinars you download for free. I'm sure once this gets posted. So they don't even have, they can just do it. The parents can do it. But yes, we need to get out. This is what we need to do. And this is why I'm so privileged by the opportunity to talk to such a very educated group that you might be able to help us get the word out. That's the goal of this. Yes, Dr. Chapman.
So I'm so grateful for this knowledge. I mean, we spend so much time doing research and discovery, and the important thing is to make sure that we aren't just publishing more papers, but to educate and activate. And so I would love a session, a follow-up session, and think about how we could educate and activate, even through our middle school program, where Dr. Camino has reached almost 100,000 youth in middle school, and many of them are in underserved communities, under-resourced. I think there's ways that we could partner on this messaging that we haven't really thought about to see if you use, and even our BrainHealth champions in the universities, that we have a session on this to be sort of a lead center, Dr. Filbey and Dr. Urschel, that we take and we do more than the science and in these treatment centers, but we educate and activate through these action habits. Because,
I'd be happy to help in any way that I can. There are a lot of good resources, a lot of good groups out there, and to maybe empower them with the firepower of your center here, that could really give them a turbo boost to reach even better audiences, or maybe reach the audiences in a different way.
Yeah, because we know knowledge doesn't change behaviors.
Yeah.
So we've got to move to the next step to activate.
Totally agree. And there's some very good organizations that are trying to do it.
Thank you for your amazing work, both of you. I'm so excited that you brought this to us, and wow.
Well, I thought what was really great about this is Dr. Filbey your team does so many great things in your lab. It's nice to partner. I say something and she shows you the research right there that's just, fresh out of the oven, right? And no, I mean, it's like, wow, this is pretty powerful stuff. It's not like I'm just, bad-mouthing this stuff over here. Right? It's like, okay, here's somebody that spent her whole life and her whole team's trying to figure this stuff out. Okay.
Any other questions for Dr. Urschel? If not, I'll turn to the online audience. I'll take one. Yeah, we only have one. We only have time for one more question. Dr. Urschel, how and what organs are affected with oral use, such as THC-infused brownies? Is any kind of use just as dangerous?
Yes, great question. So they're saying, hey, if you don't smoke it, if you just use it orally, THC is THC, no matter how it gets in you. Whether it's you smoke it, you drink it, you eat it, whatever. The thing about THC is if you take it edible, it lasts a lot longer. It doesn't last longer. It takes a while to reach the same effect. So I'm going to give you one example on edibles and show you how dangerous they are for a second, and then I think we can stop. So let's just say you go to the marijuana store and you buy a marijuana cookie, right? Chocolate chip cookie marijuana, right? You look on the back of that cookie. In many cases, the serving size. You know how the serving sizes always get you, right? All right, you think one cookie, one serving. On the serving size for a lot of these cookies, it's 1/6 of a cookie. All right, so if you find, are there any chocolate chip cookies in here? Yeah, I was hoping. That's my addiction. There's chocolate chip cookie, and I have this table. I say, okay, I'm gonna have my cookie. No, I need to share it with my table. We get a pizza cutter. We take a sixth of a cookie. Now, if I'm an adolescent, am I gonna want to wait 2 to 3 hours to get high from that piece? No, because if I smoked it, I would get high within a matter of seconds, or 10, 15 minutes at the most, at the very most. So it's going to take 2 to 3 hours for that piece of a cookie. So we're sitting around us table. We're 5 adolescents, and everybody takes a cookie, and then 15 minutes later we're bored. Must have been a bad cookie, right? So then we have another cookie. All right, we cut that up, and okay, we're going to wait 30 minutes. All right, and we do the same thing, and by the time 2 or 3 hours comes around, we've eaten 3 to 4 to 6 doses of this THC, and then you're getting really bad symptoms. Okay, you're getting super high, but the high kicks in from the first piece. The high keeps kicking in as the other pieces. That's the problem with edibles. Incredibly dangerous. It's still going to last long, so there's nothing safe about edibles. It's THC is THC, right? Yes?
So is the neurotoxin, is that the same as like?
When they say that Botox is a neurotoxin, is that similar to marijuana? And which would you say is worse, Botox or marijuana?
Okay, so they both have the word toxin in, all right? So Botox does injure the nerves, all right? But Botox is a very purified form delivered in a very localized setting in general. So it's going to hurt the nerves for this area to, let's just say if you're taking away wrinkles, it takes away this wrinkle. So the nerves, it relaxes the nerves because it hurts them. The nerves will regrow. That's why you have to keep getting Botox, every 3 to 6 months or whatever. And it's a neurotoxin, all right? The problem with let's just use THC is you don't know what the dose of the THC you're getting, because there's really no oversight if state legalizes it, the company comes and sells you, and they say this is 20% THC pure. Nobody's really going to check it. You could take it to a lab, but there's a good chance that it's 40% pure, or maybe it's 5% pure. Nobody really knows. So the higher the dose, and the longer the dose sits around throughout your whole body. THC gets into your bloodstream, gets into your lungs, still goes to your bloodstream, gets into your stomach, still goes into your bloodstream. It's going to go everywhere. Whereas the Botox is going to go right into this one little area, and it's not going to get out. Again, I'm not saying Botox is good or bad, but I'm just saying it's out there. FDA has approved it. And by the way, FDA has approved THC, okay, in a pill called Marinol. We know a dose, paid for by insurance, right? This is why we don't need medical marijuana. It's a total farce. It's a complete marketing ploy. If you need marijuana, for your glaucoma, or you need marijuana for your nausea or to increase your appetite, you can go and to get your doctor to prescribe it legally, whether it's legal in your state or not. You can get Marinol tablet. You're not going to get high, and it's still, maybe it might be a little bit toxic, but it's going to be helpful for that particular condition. Okay?
Thank you, Dr. Urschel. There are flyers on your tables. Please do support the research. We're behind the changes in policies. Policies are changing before scientific evidence, so I'd appreciate if you could support research in this field. And with that, I want to say that lifelong brain health, this is our shared mission. Thank you again, Dr. Urschel. It's been fun presenting with you. And please remember to join us on March 14th with our guest, Dr. Matt Huntelman. He is applying precision medicine principles to cognitive health, aiming to align cognitive health span and lifespan and improve prediction and prevention of age-related cognitive diseases, terming this approach precision aging. I also want to remind everyone about a new text Sleep challenge. There we go. Please scan the QR code. and join the fun. Thanks for coming, everyone.